come to this short video. I thought I'd do this today. I put a little post out about back pain, and there's lots of lovely exercises that you can do. You don't need any equipment. You can do them daily, and they will really help to ease and sort of loosen your lower back pain. Most lower back pain is not from damage. It just comes from a little bit of lack of strength, a bit of stiffness. It's more common in perimenopausal women because of that drop in estrogen, which affects your fascia and your soft tissue. So I'm just going to go through these exercises a couple of times each through, maybe sort of 10-15 minutes. There's a little bit of mobility in there, we've got some stretches, and we've got just a little bit of core work as well. So nothing crazy. The thing with back pain is if it hurts, often it's okay to work through back pain. I'm not saying force into any of the movements, but just work with your breathing, get into that range, and just practice. The more you do it, the more your body will get used to moving into those ranges. So we're going to come down with a mat into 4-point kneeling. So this is always a nice position to start in. So wrists under shoulders, knees under hips, and then we're just going to go into our cat camel. So we just start, let's go. So right, start with our rounded back, breathe in, breathe out, look forward, breathe in, breathe out. Breathe in. So you just get that lovely fluid movement. Nice. And you can do that as many times as you want until you start to feel lovely and loose through that lower back. Okay, then we come into, we widen our knees, take our arms forward and just sit back in for a full spinal stretch. And then again, just let everything sink into the floor. Don't force anything. I feel this through my left shoulder, which is really stiff. Good. And then come back up into your 4-point kneeling. Now, we're going to come into a little bit of thoracic rotation. So we take our left arm. Now we can start by just taking it up towards the ceiling, but then all we're doing is passing it underneath the opposite side. Come down. You can add an extra little element to it, just stretching out through there, or just wherever you feel comfortable. If you need a little bit of support, that's absolutely fine. A couple of breaths. Really pressing that left shoulder into the ground. And then we come back up and we can do a little bit of rotation. See how rubbish I am? We swap, we do the opposite side. So we rotate, we take the arm under, we can take that arm forward. And really pushing that right shoulder into the ground. And then bring that left arm back, bring that arm on into rotation there. Good. Now while we're in this position as well, this is a nice one just to start to do a little bit of core work as well. So from here, we can think about, without arching our back, just think about drawing your tummy button into your spine. And then just fix that there, lovely. Now, again, there's various levels. We can just start by raising ourselves a little bit here and just alternating arms, or we can alternate legs, or we can do a little bit of a Superman. You must just make sure that you're able to stabilise yourself so that you're not wobbling side to side. You'll get some wobbling, that's absolutely fine, okay? So we want to just be really lengthening out through the spine, through those muscles in the front. So again, at your level, whatever you feel comfortable with, just do maybe sort of 10 or 12 of those exercises, a little bit of core exercise in there. Okay, so come down into a lion. Okay, now, excuse me. First thing we're going to do is we're just going to practice rocking our pelvis. So often the patients I see in clinic are really stiff through their lower back and they find this quite difficult. So we're going to press our lower back into the floor and we're going to arch away. And we're going to press it back, going to arch away. And we're going to press it back. Now you can do this in sitting, you can do this in standing. So it's really nice to get that fluid movement through that lower back and into our pelvis. Okay, so that's our pelvic rocking. Okay, then we're just going to come up into our bridge position. So again, this is a nice one for posterior chain. Now I often give this as a little bit more of a dynamic movement than say like a Pilates movement. So I would get my patients to move quite quickly through that movement. You might have done it before where you roll up and down through your pelvis. So that again, there's no right or wrong, whatever feels nice for you. We get a little bit of mobility by rolling down through our spine into our pelvis. Or we can make it a little bit more strength-based by squeezing, really squeezing through our hamstrings, through our glutes. Okay, so that's your bridges. Okay, some lovely stretch, we'll need loads of space. So knee to chest. Again, we're getting a little bit of a stretch through that lower back on that left-hand side. Just a couple of breaths there. Nice, good, lovely. And then we swap over and just bring it in. Oh, that's tight. Oh. And again, just into those breaths. Move your ankle if you need to. Good, and then we're going to bring both legs in and give them a big squeeze right into our chest. And a couple of nice breaths, just let all that tension out. Try and let that tension out of your lower back, even if it feels a little bit sore. It's okay to work through these exercises. And you can give your feet, your knees and your hips a little move around if you want to. And then we're going to place them back on the floor and we're just going to let them drop from one side to another. So try and keep your shoulders flat. Again, we might get a little bit of discomfort through here. That's absolutely fine. It's quite normal to feel a bit of stiffness, a little bit of pain maybe. What I usually say is no more than about a 4 out of 10 for pain. But if you do these every day, you will start to feel that difference there. Good. Oh, I've got that. Lovely, nice. So we're going to bring our left knee up towards our chest, and then we're going to take our right hand and draw that left knee over towards our right shoulder. Try and keep the pelvis on the ground so you'll feel a little stretch into the back of your left hip there. And just breathe through it again. Good, and then place that foot onto your right thigh. Bring that right thigh towards you and just clasp through. So we'll get a little bit of a deeper stretch into those posterior structures of the left hip now. And again, if it's too much, put your foot on the floor, just bring your foot a little bit closer. But the more you do this, the easier it will get. Okay, and then we're going to swap. Going to bring that left knee in, right knee in. Left hand, we're going to pull that right knee over towards that left shoulder. Try and keep the hips down. So you might feel a little bit of stretch into that, the sort of back of the hip, maybe into glutes. And then pop your foot onto your left thigh and bring that left thigh towards you. And you might feel a little bit deeper into those posterior hip structures. And again, if that's too much, just pop your foot down and put a little bit of stress through the inside of your knee there. Good. Lovely. And then while we're in this position, position, I'll show you a really lovely little core, again a nice core exercise called the dead bug. So dead bug, we really need to be able to stabilise through our back. We come in to a sort of upside down tabletop position, and even if you can't, if this is as much as you can do, that's absolutely fine. Just stay in this position. What I want you to focus on is keeping your back strong, okay? And I want you to focus on your breathing, okay? So while you're doing this, you need to be able to access your diaphragm so that you can still talk and breathe. Often I see patients and they brace through their diaphragm. You can't breathe very successfully. So sing a little song, talk to yourself, make sure that you're not bracing with your diaphragm, okay? Once we are comfortable in that position, we can add arms, we can add legs. Again, just being able to stabilise through that lower back, whoops. And then ultimately, we want to take it to opposite arm, opposite leg. Okay, but whatever level you're comfortable at. Okay, right, so we're just going to have a little sit up, okay, and then we're going to come into our yoga squat. So again, this is a really nice movement to be able to get into hip, knee and ankle flexion, and it might be that you need to practice this. So we're just going to come down into our yoga squat, wherever you feel comfortable. And it does take a degree of core strength. You've got to have the flexibility. So if you can't do it, just practice it. Use a pole or hang on to a chair or something. And the more you do it, the easier it will get. Okay? Lovely. So that's your yoga squat. So we come up. And then finally, we're just going to go just into some nice roll downs. Again, with these, you can do them in sitting, you can do them in standing. It's just getting that lovely mobility through your spine. So we start, and being a little bit more aware of your spine as well, and how you're holding yourself. So in a nice, strong, comfortable position, think about your head being like a coconut on top of a coconut shy. And I just want you to roll down through your neck, down through your thoracic spine, all the way down. You can see how unflexible I am. And then just rolling yourself up, using your core muscles to bring you back into standing. And again, just rolling down. So you might feel this, I really feel this into my lower back here, into my hamstrings. And this might be nice, you might do a little bit of, with your massage gun if you've got one, a little bit of foam rolling into quads, into hamstrings, and you might find that makes it just feel a little bit easier. Good, and roll up. So that's your roll down, so you can also do that in sitting as well. Again, a little bit of discomfort is okay to work through, it really is. Pain often isn't a sign of damage, it's just a learned response to an old trauma. And then the last thing I just wanted to mention is, if you sit at work on your bottom for most of the day, have you thought about using one of these? So I had a message from a lady who said when she sits down after she's worked out, that's when she feels really stiff and she feels like her spine's crumbling a little bit and it just feels really stiff. So these are really cheap off Amazon. Pop it on your chair, and actually while you're working, you can do a little workout. So sitting down in one position for hours on end is not good for us. We're designed to move. Sitting should be a fairly active activity. We make it passive, we sit, we're supported, we have lumbar rolls, we have all sorts, but actually our body just wants to move. So by using the wobble cushion, giving ourselves a little workout. And I'm not saying sit on this all day because you'll probably feel knackered, but it might be that you just pop it in a couple of minutes within each hour or sort of within each half an hour. You can do figure of 8, you can do some little side to side, you can do some single leg stuff, some activities. So, and while you're at your desk, you've just got that little bit of movement going on. So you're firing all those muscles, moving that soft tissue around. We're not just wedged in one position. So that's just a really nice, I often give that to my patients who've got lower back pain, especially if they are desk workers. So have a go through those exercises. Doing them every day will be absolutely beneficial for you. If you've got any questions, drop them in the comments and let me know how you get on. Try them for 7 days and let's see if we can get some positive results.